You're listening to Puma Podcast.
Like anecdotes like I was asking my doctor for different options for birth control and contraceptives, pero ang sinabi lang sa akin ng pinaka-advice is just abstain, like just don't have sex, right? So parang
Not helpful.
like thanks.
Yeah, thanks.
Hi, you're listening to Teka Teka. What you're about to hear is an excerpt of an upcoming episode of A Better Normal, another Puma Podcast production. Jessica de Mesalim talks about Kindred, the women's clinic she co founded to address the alarming lack of women focused healthcare in the country.
I'm Jessica de Mesa Lim. Please just call me Jess. I'm the founder and CEO of Kindred. So, Kindred is a women's health company, and we're dedicated to providing accessible, affordable, and quality healthcare services that are tailored to women. We do this by leveraging technology and a customer centric approach because we want to empower generations of women in the Philippines to take charge of their health. I guess at the core of everything we do, we really believe in empowering women with the right tools, the right evidence based information to support them on their health journey. And whether that's through our virtual clinic or our physical clinics or telehealth, website, mobile app, wherever she wants to go, then we'll be able to provide that. We basically want to break down the barriers in women's health because, yes, we are a medical clinic, but I think the unique proposition of Kindred is that it's a stigma free, safe space, no judgment space for women.
Kind of want to attach to that idea of it's no judgment, safe space. And I don't think any other clinic makes that promise or that assertion. Why is that important?
Very, very important because, first of all, we live in a predominantly Catholic country where talking about reproductive health and sexual health, there's still a lot of stigma surrounding it. It's quite hard to talk about. I mean, me as a Filipina also growing up, it's so hard to talk about your
Mhm.
period to your parents, your family, or friends, right? And for us, when there's stigma or fear of judgment, it just gets in the way of seeking the right treatment and the right care for you. So we really start with that in terms of awareness and education because no matter how well designed our services and clinics are, if a woman is not inclined to actually invest in their health and take charge of their health, then we would just be an ordinary clinic.
Yeah. So of course, like I'm a dude, so of course I'm exempt from most of this stigma and most of this experience. And can you tell me a little bit about sort of why this idea comes into being?
Yeah,
What is the background where you and your co-founders go, you know what, kailangan natin ng clinic only for women?
definitely. I mean, it wasn't really a light bulb moment for me. It's been a long journey before we even were able to establish Kindred. I guess that really begins with my personal connection to healthcare. My
Okay.
family, for example, we've been deeply rooted in the medical field. And I've had firsthand experience both as a healthcare provider when I was a registered nurse here in the Philippines in public hospitals, government
Mm.
hospitals, private hospitals, and clinics as well. So coming from that side and as a female patient as well, I'm turning 40 next year. So the personal and the professional exposure inspired me to address these very specific challenges. So I mentioned I practice as a nurse. for a
Mm-hmm.
few years, for about 4 years, different types of facilities. But then after my nursing career, I worked in the e-commerce space here and
Okay.
overseas because of my background in tech as well.
Parang you
Kind of
covered all
like,
the bases para magkaroon ng future, no?
yeah, parang hindi ko naman sinasadya. Parang I've just, I guess, naturally come full circle. And then
Right.
my passion for women's advocacies as well sa lahat ng pinagdaanan ko here and sa ibang bansa. I guess over time also as I go through my own health journey, I notice the gaps, right? And parang bakit hanggang ngayon pagbalik ko sa Pilipinas 2020s na wala pa ring solusyon. When I worked and live abroad for about 8 years, it was really eye-opening for me. For example, there are women's clinics everywhere in London, in the UK. I was there for 4 years. And then when I worked in Singapore, quality care was accessible there too, pero mahal. Like super
Sure.
expensive. So
Like everything in Singapore, ganun.
like everything in Singapore, may maraming hindi din covered ng mga insurance. Pero it's there. Like, the solutions
Yeah.
are there. The innovation is there. Everything's tech-enabled. Like, everything at my fingertips. I had apps for different sorts of things, actually, that helped me. So I guess because of all of that, Kindred is like a love letter to our younger selves. It really is. It really, really is. And my business partners, the Kindred team, and I, we know a lot of different women around us. We hear a lot of anecdotes as well from our family and friends who are looking for the right solutions here, whether that's shorter waiting times, better environment, more progressive doctors. It's quite hard to navigate the healthcare system here, to be
Yeah.
honest. Like, you step into a hospital and there's a whole directory of specialties and names,
Mm-hmm.
and you're like, okay, where do I begin? So then, I mean, my business partners and I are investors, once we had the means and capabilities to actually start building solutions and testing and learning from that, we finally, in late 2021, I quit my very, very comfortable corporate
Mm-hmm.
life, and back to the Philippines.
More from Jess after a quick break.
And it took you going abroad to see, meron palang ganito. It can be done, or this is a service there, but why are women in the Philippines not getting it? Could you talk about one of those like really big ones na women here aren't even aware like they should have or they should be
Correct.
availing of?
Correct. Naku, ang dami. Where do I begin? Our chief medical officer is infectious disease specialist. Also, she's an OB-GYN. And we've been researching a lot and talking to different organizations and even LGUs about preventive services. Kasi I think the common thing about, like, our perception about healthcare is, oh, pag may sakit, di pumunta ka ng doktor. But
Mm-hmm.
actually, it will save you a lot of headache and a lot of money if you actually start investing in preventive health. For example, HPV vaccine is one of the very few vaccines that can prevent cancer. So this is targeting the human papilloma virus, or the leading cause of cervical cancer. And cervical cancer is the second leading cause of death in women here in the Philippines. Number one pa rin yung breast cancer. So I can touch
Yeah.
on that later. But most 98% of the women who have gotten the HPV vaccine from Kindred, when we surveyed, did not know that such a vaccine existed until
Wow.
they saw us on social media. 3 doses, lifetime immunity, protected against cervical cancer, which is a very common cancer here. So it saves lives. It's 20,000 pesos for 3 shots, 20 plus thousand pesos for 3 shots. If you think about it, wow, mahal. But if you can actually prevent that, especially if you have a familial history of cancer, that's nothing. That's 20K is peanuts for the
Yeah.
amount of costs you could experience later. Aside from that, contraceptives, a lot of the
Mm.
women that we service for intrauterine device, birth control pills, unfortunately, some of them get turned away in the centers, in the local health
Mm.
center,
Ayan
because
nga, yung
it's
stigma.
yeah, well, the funding then kasi a lot of centers they run out
Ah,
also of free contraceptives. So then they come to us instead para even if it's not free, even if it's not covered, it's not contraceptives are not covered by our
mhm,
HMOs and insurance,
mm,
at least mas mababa yung
yeah,
price sa amin. So, PCOS, polycystic ovary
mhm,
syndrome. So I'm on my third in the top three na.
yeah,
PCOS, a lot of our patients 35 and up pa lang nadadiagnose ng polycystic ovary syndrome. And it's a lifelong condition, unfortunately. Walang straightforward cure. It's when cysts attach around your ovaries, and then it's a systemic issue also because it affects your skin, your weight, sudden like hair growth or alopecia, hair loss, like lots of things going on because your hormones are imbalanced. So, unfortunately, before even getting to the right diagnosis, they've had to do a lot of like repeat consultations with their providers until finally we're able to diagnose in Kindred. So, lots of stories like that, unfortunately.
women are so underserved. Uh, parang if again like as a person who encounters the medical system, it's difficult enough. And I might imagine na iisa lang naman yung hospital, iisa lang yung doctor.
Mm-hmm. Definitely. I think, well, times are changing, Carl. We're seeing a lot of, now we work with about 70 plus different types of doctors across 25 different subspecialties. And
Yeah,
we're finding more and more like these network of very progressive doctors, which we're super happy about.
yeah,
And those are the type of healthcare providers we're looking for, so that it's a win-win partnership for us. Like we provide the platform and we connect them to the patients. Well, two main things coming out of our recent surveys why they don't want to, why patients are hesitant to seek care. One is that fear of judgment because they were already judged and shamed before.
yeah, yeah,
They were already dismissed before, natatakot na silang bumalik, or they just don't want to experience the trauma ever again. Sometimes by their own providers, unfortunately.
okay,
Like anecdotes like, I was asking my doctor for different options for birth control and contraceptives, pero ang sinabi lang sa akin ng pinaka-advice is just abstain, like just don't have sex, right? So parang
not helpful.
and then the second, like from our recent
Mhm.
surveys, is the type of woman na okay, they're aware of the solutions. They're just too busy and don't have the time.
Right.
Kasi pag nagpapa-check up kami, kailangan magli-leave ka from work kasi mag-aantay ka ng half day or full
Mhm.
day nakapila.
Yeah,
Walang scheduling system, or even if there's a secretary of the doctor, you would wait like 1 to 2
yeah,
weeks for the secretary to get back. So wala kasi yung technology, hindi tayo nag-i-invest sa
right.
technology behind our systems,
Yeah,
right? Which we have been doing since day one of Kindred. Kasi it doesn't just, technology doesn't just enable our operations, it's addressing this pain point of a very busy woman. Our patients are from 22 years old to 40 years old. So imagine they're building their careers and families, madaming kailangan alagaan, parang paano pa nila iisipin yung sarili nila.
I hope you enjoyed this conversation with Kindred co-founder and CEO, Jess de Mesa Lim. I'm Teka Teka reporter Bella Perez Rubio. If you'd like to learn more about the clinic and the services they offer, check out their website, mykindred.co. And if you want to hear more stories about innovations in tech, business, arts, and humanities and advocacy work, listen to the episodes of A Better Normal wherever you get your podcasts. This episode was produced by Geraldine Pascual and edited by Pidoy Blanco, with support from Jill Caro and Carl Javier. Thanks for listening.